Hi, my name is Nicole Fox. I'm a certified PA practicing rural family medicine in Southeast Utah for San Juan Health. And I'm excited today to start this micro-learning series with you about obstructive sleep apnea. For our first video, we're going to focus on the prevalence of OSA and how we can learn to suspect this for our patients. OSA affects about 1 billion people worldwide, but of those about 1 billion people, only 1 in 50 will be appropriately screened, diagnosed, and treated for the condition. There are 3 types of sleep apnea. There's obstructive, where there is a blockage of the upper airway that's causing impaired respiration. There's central sleep apnea, which is impaired signaling from the brain to the muscles of respiration. And then complex sleep apnea, which is a mixture of both central and obstructive. Of all of these 3 types, obstructive sleep apnea is the most common. So what exactly is OSA, or obstructive sleep apnea? Obstructive sleep apnea is a pattern of repetitive interruptions of normal breathing during the night, which then results in interrupted patterns of sleep. So when you have these interruptions, this causes autonomic dysregulation and activation of the sympathetic nervous system, and ultimately disrupted and broken sleep. We often find that patients that struggle with sleep apnea often make these gurgling, snoring noises that sound like they're either not breathing or having a really tough time breathing during the night. And so often it will be a patient's spouse or bed partner that might notice these first symptoms and encourage their partner to get treated. It's not just partners who notice symptoms of sleep apnea. Oftentimes, patients will report that they wake up early in the morning not feeling rested or feeling like they haven't slept at all during the night, even if they've had multiple hours of quantitative sleep. They also might report issues with insomnia and waking up frequently to go to the bathroom. During the day, even if patients don't recognize that these issues are due to sleep apnea, a lot of patients will often report that they feel fatigued, that they might have some brain fog, there might be some depression, irritability, and some mood changes, impaired ability to concentrate, impaired ability to problem solve during the day, or even increased risk of accidents due to inattention. In addition to the subjective symptoms that patients experience, patients can also have, unfortunately, a very high risk of a lot of comorbid conditions if they have untreated sleep apnea. Sleep apnea increases the risk of heart disease, of hypertension, of metabolic disorders such as diabetes, of neurodegenerative disorders over time, impaired memory, and depression. So why does sleep apnea increase the risk of all of these chronic diseases? When you have that repeated activation of the sympathetic nervous system at night, what's happening is it causes changes in blood vessel tone and blood vessel responsiveness over time. The way that I like to explain this to patients is it's like your body is constantly fighting from drowning over and over and over again at night. And so over time, this can lead to real changes in your vasculature, in your glucose metabolism, in your lipid metabolism over time. We're not quite sure why these impairments in glucose metabolism and lipid metabolism occur, but we do know that OSA is a very strong predictor of metabolic syndrome, diabetes, and hyperlipidemia. When a patient comes in and has any symptoms that are suggestive of sleep apnea, it's important to also look for some phenotypic or history-related clues that might indicate that sleep apnea is a problem. Some of those clues include hypertension, male gender, middle age between 40 to 70, having issues with sleep, any use of sedatives or hypnotics. And this is really tricky because a lot of these patients are going to be coming in asking potentially for sedative hypnotic medications to help with sleep. But it's really important to know that things like alcohol or sedative hypnotic medications can actually not only be causing sleep apnea or contributing to it, but making the problem worse as well. We can't rule out sleep apnea if any of these risk factors are not present. However, we should be screening more appropriately for patients that have any of these risk factors in addition to describing symptoms that are suggestive of sleep apnea. With the extreme underdiagnosis of sleep apnea, it's really crucial that we as PAs keep this on the differential and appropriately screen and then lead to the pathway for treatment for these patients. In our next video, we'll go over how these screening tools can be used and what to do next for a patient that you suspect has sleep apnea.